guys, I hope you're excited, studying is going well, and you're ready for the big exam coming up. This is going to be the videos covering insurance and some of the ethics and other aspects of the INBDE exam. So the first thing we're going to talk about is insurance. So what is it? Let's start with the policy. The policy is basically the inpatient's insurance. It's purchased on a marketplace or through an employer, and it is either individual or family. And basically, policies are when the patient signs a contract, and that allows them to pay for their care. So a couple vocab words to pay attention to. The first is the insurer. So this is basically the party or the insurance company that the policy is through. These guys assume the risks. So basically, for the dental insurance, the insurance pays the benefits for each of the dental exams. The next one is the policy holder. So this can be a group or an individual, but it's essentially the name under which the plan is for. So for example, the individual is frequently the patient, but sometimes it can be other people that are included on the plan. The beneficiary or the insured is any individual that is eligible for the benefits of the insurance. So this is basically your patient. This can also be an eligible family member. The last one is the provider. And so this is you. This is basically the dentist, the dental hygienist, or anyone else that qualifies for payment. So let's take a look at the whiteboard, just so I have a handy diagram to help you get everything down. Okay guys, so this is the basic components of a dental insurance policy. We have the premium, which is the fixed amount that the patient pays the insurance company. So this is our dollars. Then we have all the benefits. The benefit coverage is provided by the insurance company after the deductible is met. So this is the amount that the insurance company pays for a specified dental service. The specific amount is outlined in the insurer's allows fees. So in many instances, the insurer does not cover 100% of the allowed fees. Next up is the deductible. So this is a fixed amount the patient must pay out of pocket before coverage and benefits begin. So this can be really variable based on the type of insurance plans. Deductibles for dental insurance plans frequently are in the range of $50 to $200. Next up is coinsurance. So this is the percentage of costs paid by the patient for services after the deductible has been paid in full. So essentially the patient pays out of pocket until the deductible and then some percentage of each exam afterwards. The copayment is the fixed amount the patient must pay anytime a covered service is rendered. So when you're thinking of insurance policies, I want you guys to imagine this diagram. First is the insurance policy. So this is the contractual agreement between the insurer and policyholder that provides benefits in exchange for a premium. This is what the patient deals with when you have your various companies. The policyholder is typically the patient, but can be another family member. And so there's an exchange that happens here where they purchase the insurance policy. Then the patient interacts with the dentist. So the dentist renders services to the patient in exchange for a fee, which is paid by the insurer, the patient, or both. After that, the dentist will then choose to participate or not participate with a particular insurer. So there's another exchange of the fees, but this one can be up to the dentist. And then the insurer is the person that has the insurance policy that then goes to the patient. Okay, guys, now that we've covered that topic, let's do a quick question just to make sure that you have those terms straight. Great job on that question, guys. Let's keep going along. So the next term is going to be fee schedule. So this is determined by you or the dentist, and this is going to be the cost to the patient per procedure. The accepted or allowable fee is determined by the insurer. So this is the maximum dollar amount paid by participating dentists for the procedure. So when you go in network with a company, the insurer will determine this fee. So it's determined by usual, customary, and reasonable, or a UCR fee. And basically the insurance companies look at the relative cost of a geographic area to try and keep the fees all fair for everyone. Then there's something called balance billing. And this is basically the dentist will charge the difference between the fee schedule and the allowable fee by the insurance. So this is illegal if you are in network with the insurance company, but it is legal if you are out of network. So guys, now let's just jump to the whiteboard and map out some of the more technical terms. So all dental procedures have a procedure code. This is determined by the ADA, or your American Dental Association. And basically dental procedures and nomenclature codes, or the CDT code. The purpose of this code is to achieve uniformity, consistency, and specificity in accurately documenting dental treatment. So some of the terminology for the procedure codes. So bundling is going to be combining ADA procedure codes by the insurer, which results in a reduced benefit for the patient or beneficiary. This patient is frowned upon by the ADA. So we're just going to remember that it's frowned upon. Unbundling is when you separate the dental procedure codes. This is typically done by the dentist into component parts so that the cumulative charge of the components is greater. For example, if the dentist performs a root canal but submits the ADA procedure codes for a pulpotomy and a root canal, this is not great because the root canal code should be submitted because the pulpotomy is a part of the root canal procedure. Overbilling is the practice of the dentist increasing the fee schedule to the patient because the patient is covered under dental plans. This is unethical. This is also a bad idea. Downcoding is changing the procedure code to a less complex or lower cost procedure code than was submitted by the dentist. This is typically done by the insurer. And then upcoding, this is changing the procedure code to a more complex or higher procedure cost code. This is typically done by the dentist.
Nice job, guys. Here's another quick question to make sure that we got those terms. Great job, guys. So let's go through the two major categories of insurance plans. First, we have our private plans, and then we also have our government plans. For government plans, this includes your Medicare, Medicaid, and CHIP programs. For private policy, this includes your HMOs, your PPOs, your dental indemnity plans, and then your fee-for-service plans. So let's take a quick look at the whiteboard to make sure that we understand all of these details.
Okay, guys, while this may look like a lot of text, let's try and keep this as simple as we can. So Medicare basically seeks to provide healthcare coverage for individuals aged 65 and older, although younger individuals with a disability can also be eligible. It's divided into 4 major parts. So Part A covers hospital or inpatient services. Part B is going to cover outpatient. Part C is referred to Medicare Advantage. This allows for individuals to purchase additional benefits, such as your dental benefits, beyond those covered in A and B. So this is going to be the big thing for you guys to know. That's going to be our dental ones. Part D is going to cover prescription drugs. Keep in mind that dental services are not a required benefit under Medicare. So Medicaid is a federal and state program that seeks to provide healthcare coverage to low-income individuals. So this is usually used by children or pregnant women, elderly, or sometimes those with disability. Eligibility is determined by the state's criteria. So for dental services, this is where you guys need to pay attention. They are a required benefit for eligible individuals that are less than 21 years old. However, they are not a required benefit for those eligible individuals that are 21 and over. Next up is going to be our CHIP programs, or the Children's Health Insurance Program. Basically, this provides low-cost healthcare coverage for individuals under the age of 19 from families with modest incomes that don't quite qualify for Medicaid. So remember, Medicare is my older patients, Medicaid is going to be my children and pregnant women, and then CHIP is anyone that is still younger that doesn't quite make the financial qualifications of Medicaid. Keep in mind here that dental services are a required benefit and must include relief of pain and infection, restoration of teeth, and maintenance of dental health.
Nice job through the government plans, guys. Let's go into some of the private coverage details. So let's take a look back at that whiteboard.
Okay, guys, this may look like a lot of text, but let's try to keep this as easy and as simple as we can. First, let's talk about the HMO plan. Dentists need to elect to be in-network. Basically, this is the dentists are paid based on the number of procedures they perform, not the complexity. Also note that the overall cost to the patient is usually less than that of a PPO plan. So the preferred provider organization, or PPO plan, is probably the most common. The dentist agrees to accept less than their normal fee schedule in return for a higher volume of patients from the insurer. So this is less and more. The patients are not required to have a primary dentist, so they can be treated both by in and out of network. So the cost of out-of-network dentists are typically more than that of in-network, and referrals to specialists are usually required. So most dental PPOs cover all in-network preventative care, but may only cover a percentage of simple and complex restorative treatment. So a dental PPO may have something called a 180/50 schedule. Basically, this means that the insurer pays 100% of the preventative care, and the patient will pay 0%. The insurance policy will then pay 80% of any simple restorative procedures. The patient will pay the remaining 20. And then the insurer will also pay 80% of complex restorative procedures, and the patient pays a remaining 50%. So the dental indemnity plan, or fee for service, basically no dental provided networks. So dentists are paid by the procedures performed. And this is typically paid by a normal fee schedule. Patients are able to select any dentist that they would like. Referrals to specialists are not required, and the overall cost of the patient is usually greater than that of an HMO or PPO plan. Premiums are typically low, but there are very high out-of-pocket costs. So typically there is a deductible for the patient and some co-insurance. Okay, guys, there's a lot of text here, but let's again try to keep this simple and go over it one more time to make sure that we have the key differences between these types of plans down pat. So keep in mind for our HMO plan, make sure that you remember that dentists are in or out of network with the insurer, and the dentist is paid according to the number of patients, not the procedure that they do. So for the patient, there are typically fewer dentists. It requires referrals, and the patients have a limited choice. The cost to the patient is usually less than that of a PPO with lower premiums. For the PPO plan, keep in mind that dentists again are in and out of network, and the dentist is paid by the complexity of the procedure. So the dentist may accept less than their normal fee schedule for a higher volume of patients. For the patient, this means that the network of dentists is larger. Referrals are not required to see a specialist, and patients have a greater choice when seeking a provider. As far as cost goes, the overall cost is more than that of an HMO. There are typically higher premiums, but patients have an annual benefit maximum, pay a deductible, and often pay a considerable percentage of the fee. For an indemnity plan, basically there are no dental provider networks for the dentist to participate in, and the dentist is paid by the procedure performed. Dentists are usually paid according to their normal fee schedule. For the patient, they are able to select any dentist because there are no provider networks. Referrals are not needed to see a specialist. So the overall cost of the patient is greatest. There are lower premiums, and the patient pays a deductible and often pays a considerable percentage of the dentist fee.
Nice job, everyone. Let's take a quick quiz just to make sure you got some of those key points down. You're crushing it, guys! The last but not least is the consumer-driven dentist plan. So this is not an insurance plan. This is basically your patient pays for the procedure. It's done between the patient and the dentist with no policyholder or company involved. Great job, guys. I'll see you on the next video.